professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, and in this segment, I'm going to be going over some risk scoring calculations and tools that could better aid physicians and public health practitioners alike. So let's take a look here. The first one is something I use all the time, is the Calc. And so this is a measure of creatinine clearance and glomerular filtration rate that can be equated from that. And in my research, I'm almost always using that. There's some CHADS2 scoring for atrial fibrillation, which is worth looking at. And the CHADS2 score, if you want to look. Atrial fibrillation stroke risk. So CHF history, if there's congestive heart failure, hypertension history, age 65 maybe, diabetes mellitus history, yes. Usually these take place hand in hand. And if the individual had transient ischemic attack, then they are in the high risk group, greater than 8.5%. By points directly, high risk of thromboembolic event, 12.5% of event per year if no Coumadin. And then the adjusted stroke rate was the expected stroke rate per 100 person years derived from the multivariable model, assuming that aspirin wasn't taken. So these are all the different options and statistical sort of background that you can build on. Let's take a look back. So now we continue onwards, looking at different types of measures which I'm familiar with. I'm going to point out that's septic shock criteria, and then mean arterial pressure. All of those are important. Septic shock is important to track and score. Another one that I'm familiar with is the Child-Pugh score for cirrhosis mortality. Glasgow Coma Scale is one that's very popular that also I've used. Then there's a scale for pulmonary embolism. And then there's some cardiac risk index, and it can get pretty specific and narrowed down here. So you can look at the newest hot off the press, and that's COVID-19 is a lot of risk scoring. However, acute and chronic liver failure is important. Again, this goes back. Let's take this back here. There you have it. Here's all of the risk scoring, newest risk scoring, and you can press the star button right next to it, and then take a look at your favorite ones that you refer to all the time. Mortality score for COVID-19, there's so many of those. Biliary pain, and you can narrow down. So these are all the different risk scoring techniques that you can think of. It's a one-stop shop for all of those, and these are important for clinical scientists and researchers alike. This is a vast discipline. Thank you for listening.